It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Welcome back. Our next guest, Dr. Laurel, pediatric orthopedics physician from Swedish Pediatric Specialty Care. Today's topic, leg length discrepancies. I always was fascinated growing up, Shannon, as a big baseball fan. Jim Palmer, the old Orioles pitcher.
There you go.
One leg was shorter than the other. I thought that was just amazing. He could function like an athlete with that.
Well, that's important. I mean, you can have a leg length that's functional or structural. It depends on what type of leg length you have, but we're going to find out from Dr. Salimon.
All right, let's hear it.
Dr. Salimon, welcome back to Health Talk. How are you?
I'm doing well, thank you.
I'm glad you're here. It's going to be fantastic. I wanted to talk to you about your practice, and I always like to kind of check in with people that come on the radio and physicians and talk about what they do. What is the day in the life of Dr. Salimon like?
So I'm a pediatric orthopedic surgeon, which is basically a general orthopedist for kids. I treat a lot of falling off the playground equipment kind of injuries, sprains, as well as some deformity. I do infant clubfoot, some scoliosis, and also leg length discrepancies.
And that's what we're here to talk about today is leg length discrepancies. Tell us everything you know about leg length discrepancies.
Well, it is a broad discussion and subject, and it can be caused by several different causes. If you have a child who is born with a leg length discrepancy, it's noticeable at birth. That is one category. Others can be caused by an injury around the growth plate of the knee or the ankle. And that's something that would not be apparent when the child is young, but as the child grew. And then there can also be something called an apparent leg length discrepancy. Perhaps there's something going on with the joint of the hip or the knee that makes the leg look shorter, but isn't really an issue with bone length.
An example of that would be, so that's a mechanical change caused by bony growth or even like scoliosis. Sometimes could that cause a leg length, a shift in the pelvis, something like that?
It certainly can cause a scoliosis can make it look like there's a leg length difference if the pelvis is not level.
Right.
Alternatively, a difference in leg length can make a child look like they have scoliosis.
Oh, yeah, good points. It's all mechanical. I mean, the skeletal system is pretty fascinating.
We're all links in the chain.
Yeah, we are. That's right. The kinetic chain. All right, now we're getting into some kinesiology. I'm liking this. So tell us, you talked about why would you be born from a genetic component? What would cause a leg length in gestation? What would cause a leg length problem?
So it's not exactly clear the gene background. However, it is there are situations when a child can be born with maybe missing a portion of their lower leg, which also results in a leg length difference. And also there's a huge population out there. About 23% of the population has a leg length difference of a centimeter or, about a half an inch or so, and they never even notice it.
Right. And that's important to note. I mean, you might have a slight leg length discrepancy that does not need to be corrected. I mean,
absolutely.
It's very functional. And as a physical therapist, we are constantly checking leg length when people come in for different symptoms, conditions, low back pain, etc., knee pain. You always look at the leg length, and a lot of times we identify a leg length discrepancy, but do not correct it because it's not a problem.
Absolutely.
But your job is, if it needs to be corrected, that's where you come in. Tell our listeners, though, I think it's important because I remember growing up as a kid, and every once in a while, someone in the neighborhood would fracture a bone, and you'd hear, "Oh, you better not have gotten to the growth plate. It better not have caused because you'll be deformed." You know what I'm saying? Remember how kids are, right?
Right.
You got a fracture, you're going to end up like limping around because you have a deformity. Tell us about those Salter fractures, you call them, or those growth plate fractures.
Absolutely. So fractures around the knee, so at the end of the femur or at the top of the tibia, can be associated with the types of injuries, skiing, football, things that might also cause a sprain in an adult. It is very important that those injuries be treated and recognized, and then also followed over time. So somebody who has an injury around the knee, I always like to see them back 6 months after the fracture to make sure that growth plate is growing properly. If it is not, sometimes bone will grow across the growth plate where it shouldn't be, and surgery can be performed to remove that little bony spot weld if that's appropriate.
Yeah, so that growth plate is really important not to be disrupted during that pediatric and particularly adolescent period.
Absolutely.
All right, we're going to come back with Dr. Salimon in just a moment, but pretty amazing what can be done with people who have these issues to overcome with their discrepancies in their leg length.
Yeah, growing up, we always were worried about fracturing that growth plate because then you'd have a short leg, right? I remember talking about that all the time.
Yeah. All right, we'll come back with our second segment with Dr. Salimon right after this time out on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
We continue our conversation with Dr. Laurel Salimon, pediatric orthopedic physician from Swedish Pediatric Specialty Care, and Shannon O'Kelly.
Dr. Salimon, again, thank you again for joining us and coming back on. I want our listeners to really appreciate you're a pediatric orthopedic surgeon. So everybody listen to this. Pediatric bones are different than adult bones, and your job is really challenging because you have to know when to intervene and when not to, because these bones are essentially cartilage, really. They're very soft. They're very, they're growing. They're changing. They're a biological structure. And how do you decide when to intervene in a leg length discrepancy and when to let it go?
So one of the important things to do is to try to predict how much that leg length difference is going to be when the child is fully grown. If the leg length difference is going to be up to 3/4 of an inch, nothing needs to be done surgically. If there's any symptoms down the line, a small lift could be placed in the shoe to help with any pain associated with running sports. If the difference is going to be greater than 1 inch to a couple of inches, we can do something called an epiphysiodesis, and that's where we actually cause damage to one of those all-important growth plates on the longer leg, allow the shorter leg to catch up so the leg lengths are equal when you are done growing. There are certain instances when the leg length difference is going to be so great that even that type of surgery isn't going to work. And in that instance, we can do something called a leg lengthening. There are several different techniques. It's a big process, but it is incredibly powerful and very successful for handling very large leg length differences.
Is it easier from a surgical standpoint with better outcomes to lengthen a leg or shorten the long one? What's the option there?
It is easier surgically and easier on the person to do that shortening procedure. However, the overall height of that person when they're done growing will also play into your decision. A 1.5 inch leg length difference in somebody who is 6'2", if you do that shortening, that's going to be better tolerated than somebody who's only going to be 5 feet tall. So really, you really want to tailor the treatment to the individual person and what their expectations are when they're done growing.
Like I said earlier, pediatric orthopedic surgeon, there's a lot to think about because you're anticipating looking at the growth of this person over time. Is there a best time to perform this surgery? Is there a time where you might say, let's let it wait a little bit because it's better to do it when they're 14 or better to do it when they're 16? Is there any kind of indication there?
When assessing and counseling families about leg length differences, I don't do anything if the kid is under 5. If a leg length difference is noticed, it really depends on how big the difference is and how quickly the kids are growing. So usually intervention surgically is going to be done sometime in the 10 to 14 age range.
Is this condition more prominent than most people would think? Do you see this fairly frequent? Is this a big part of your practice?
I see leg length differences very frequently. It is actually very infrequently that anybody needs to have any surgical intervention.
Wow. Fantastic stuff. And I'm glad that people like you are out there to help these young people. But I got to tell you, as we opened up, you talked about kids playing on playground equipment. Do you remember that merry-go-round? When you push that thing and try to jump on and off of it? Wasn't that crazy? Do they still do that? That's good for your work, isn't it?
I do get a lot of business from the monkey bars and the merry-go-round.
Exactly. Yeah. Thank you.
My pleasure.
All right. Thanks to Dr. Laurel Salimon, pediatric orthopedic physician, Swedish.org if you'd like more information. Is this something you guys deal with regard to people coming in for therapy?
All the time. This is a musculoskeletal situation that therapists work on and with all the time.
All right. Next guest, Dr. Rodney Yen, will we continue after this time out on Como.